Hi, I'm Joe Feeks, editor of Pig Health Today, and with me is Fabian Chamba. He's a PhD candidate at the University of Minnesota. Thanks for joining us at the Leman Conference today.
Thank you for the invitation. I'm very glad I have the opportunity to share my work in University of Minnesota. I work with Montserrat Torremorel, and Monsi has been working with the influenza for the last 8 years now, so I'm very glad that we have the chance to share the information for.
We know that there's a lot of great work coming out of the University of Minnesota on swine flu. I'd like to hear more about what you're doing, because I understand that with respect to swine flu, you've been trying to determine the relationship between the immune status of the sows and the status of the piglets. What are you learning?
I think we are not learning too much. We have more questions now than answers. This specific project, we were looking for, if you vaccinate sows, how those antibodies can be related to the infection in the nursery in this case. And we set up a study in which we follow one breeding hare and we follow several groups over time from the same hare. We did a lot of sequences, not a lot, but we did some sequences of the samples in the breeding hare and also in the groups that we follow in the nursery to make sure that we have the same virus and we can cross information and see the virus is the same. Because now we know that you can have easily more than 2 viruses circulating in the same farm. And it was the case in this study, actually. We have 2 viruses, but just one was the dominant, at least in our study. And we set up the study, 10 cohorts. We followed 2 nurseries with 2 or 3 batches in each nursery. And we found 4 different patterns of transmission in this. The first one was when you have a lot of virus at weaning, then decline very, very fast, and then no more peaks of infection during the nursery.
So you have a lot of virus at weaning,
Yes.
and then there's a rapid decline. What would cause the rapid decline?
We measured the antibodies too, and the antibodies in this particular first parent, it was very low. So we have less than 10% of seroconversion in this case if we use a cutoff point value of 40 in the HI titers. So this was the first parent. The second one is similar to the previous one, the first one, and in this parent we have a lot of virus again at the beginning, no antibodies, almost no antibodies at weaning, but then we have a second peak of infection in the middle of the nursery, which is very interesting because we can see also the response and immunity based on that. To continue with the parents, the third parent was, since we did some, not us, but the farm and the veterinarian in the breeding hare, they did vaccination in the sows for a couple of months. So we've tracked some groups that were coming from those sows that were vaccinated. So we had a chance to measure now pigs with a lot of immunity, but they still have a level that we call medium prevalence of the virus. But in this case, the peak was delayed somehow. We believe that it might be related to the effect of the maternal immunity. We still don't know. We have to remember that we are measuring antibodies with HI.
Sure.
And they vaccinate the sows with a commercial vaccine. So we make sure also that the matching between the vaccine and the strain that we were able to characterize in the groups, they were similar, and the similarity was very high. And we check also key putative amino acids that can be responsible to change that protection or immunological response somehow. And we found no amino acids changes, at least in those key positions or key antigenic sites. So that was kind of okay. Looks like makes sense in this case. And we have the last group of piglets. Again, they were coming also from sows that were vaccinated. And in this case, the level of the virus was very low. So that's kind of helping us also to say, okay, we believe that the sows are passing high quantities of antibodies, and in this case, antibodies that were specific to this strain that we know that were circulating in there can be associated with the fact that they are not getting infected very fast in the nursery. The last parent also have very low virus circulation. Even we don't have any positives by PCR at weaning, and then the circulation was very, very low. We have like 3 or 4 positives in the nursery in these particular groups in the last parent. So that's the 4th parent. So that makes us think that, okay, it looks like you have a specific antibody to a certain strain that you know that is circulating. You have to do the sequencing and stuff to make sure that it's the case. Then it seems like this can help to reduce the circulation of influenza, at least in nursery. We didn't follow finishing sites, That's something that we need to do. That's an idea, and we believe that we can reduce the circulation of the virus if you vaccinate the sows with a vaccine that is matching very closely to the virus that is circulating.
Well, and swine influenza is a complex disease. It's an elusive disease. Taking a look at your research that you've been doing at the University of Minnesota, what would be the takeaway messages for veterinarians and producers as far as the most effective way to manage swine flu?
We have been working on the same question for years. It's not easy. I wish we can come out with a recipe and say, you have to vaccinate all the sows every 3 months in a whole hair fashion, and then you're done. Influenza is going to be away for a while. It's not the case. We have been studying this and discovering, or maybe discovering not the right way, but we have been able to generate data to say that piglets are a key subpopulation in maintaining the virus. Now we understand that since piglets can maintain the virus, almost all the farms that we have in the United States, they are positive in different levels to influenza. So influenza is an endemic disease now in people. We know that now. We know also that the level of the virus in those piglets can vary over time. We know that here in the Midwest especially, we have variations in temperature, we have seasons, and now we understand that the levels of influenza are also varying according to the season. So influenza is seasonal too. It's endemic, it's seasonal. With the conventional sampling strategy that we have in farms outside, we sometimes don't detect the virus. So we also know that the virus can be in there with a very low levels. And we think that we are negative. We think that the piglets that we are winning are negative. And they are not. We have very low levels that are kind of, they call it leaking of the virus. So, and then the virus show up in late stage of the nursery or in the finishing. So my recommendation will be, based on the nature of the virus for the veterinarians, to do more surveillance. We need more surveillance. We need more surveillance in the companies to understand where the virus is, which viruses do we have, is these viruses similar across time, across farms, these viruses are matching the vaccines that we are using, so we can change the vaccines and reduce the circulation somehow, because this virus, if you give the chance to influenza to circulate and replicate, you will have a virus that is changing more and more and more.
And from what you've said, I gather that the focus really does need to be on those baby pigs.
Yes, we believe that based on what we did so far. It might change in the future. We don't know. This is a science. This is biology. We don't know. But I think we should focus on piglets. And it's, maybe vaccination is the way, maybe not. There is other strategies for disease control that we haven't explored yet for influenza. There is early weaning, hair closures, batch farrowing, that we don't understand how that can interact with the value of reducing influenza in those farms. So.
Well, it's a confounding disease, and I'm sure the industry appreciates all the good work that you and your colleagues are doing. So thanks for telling us about it.
All right.
We've been talking to Fabian Chamba. He is a PhD candidate at the University of Minnesota. Thanks again for joining us, Fabian.